me see.
Yeah. See?
Yeah. Which bird is this?
I'd say it was some sort of flycatcher.
Yeah. Is it
Yeah.
mine? Which one were they? Which one were they? Zebra finch? Zebra finch? No, it's not that. Okay. Okay.
You guys have I've got where is it? Is it near me? I got a big fat book on birds. I just
Oh,
had it out the other day. Indian birds, just birds of India. So
okay.
such a beautiful range, of course, but just such a beautiful range. And I do like birds and fish too. See how their colors, they're so iridescent and amazing. Fish are this and sea coral are the same thing, just these crazy iridescent colors. So, yeah. So what's everybody been up to? What are the stories from this week? I think you said something, Newton. Did you have some interesting tales to tell?
I don't remember.
Ah,
I don't remember. Did I?
oh, it's such a relief. And Krista, greetings. Hello. So okay. Divya, I know you can tell story right now, right?
Yeah, I wanted to share my screen. I'll join from my laptop. Give me a moment.
Okay, good. So I wonder if you got any further on the fibroid myometrial discussion.
Yes, we did.
And
So,
what else? I wonder what came out of that. What was the next thing?
fundal. So Divya was little concerned about it shouldn't be the fundal. It shouldn't be on the fundal area of the uterus.
Yeah,
And so myomectomy doesn't happen there. I mean,
right.
so there is a supra-umbilical cut from where we put the laparoscope, and then or from the cervix, depending, or on the left or the right, and then we take one incision on the left or the right, pubic around the pubic area, and from there we do the incision. Now, I also feel that if Divya calls the doctor who did it, she'll have more details because as far as I could read, as far as I read the OT notes, the operation notes, and fundal was not mentioned there. It was mentioned anterior lateral. So we are
Okay.
assuming. So I'm going to assume that it's going to be on the pubic symphysis line, meridian. But also, I guess, as the doctor also asked Divya's mother that, or told her that you are childbearing, so it's better to remove the fibroid. So I'm guessing then she will not touch the fundus and Divya will share more.
Yeah.
Maybe if you could make me co-host, it will give me that.
Okay. How about do this? Okay, so I've given you the co-host. There you go. Yeah.
So kind of, sorry. So kind of how I arrived at all this was just one of these days, the mother was complaining again and again about nausea, and she was concerned that this has been the worst nausea I've ever had throughout the pregnancy. So I was reading Anne Fry, and from reading Anne Fry, we came at a particular uh, symptoms of third trimester nausea could be because of following reasons. A lot of those reasons were ruled out, except there was one that said silent uterine rupture. That kind of caught my eye, and I was like, silent uterine rupture is something, because all this while I only knew that a uterus ruptures with some bleeding and there are symptoms of the uterus rupturing. Then I got into more reading and read more about what happens when there are fibroids and what kind of fibroids are there. So in this case, the fibroid was never an issue. She still has fibroids, the case that we are discussing. And the fibroids were intramural, meaning not in the cavity, in the walls, the two sides inside the walls. And they're not too big. They're the size of a small tape. So we weren't concerned. But somewhere down the line, Anfry also said that with the hormones of the pregnancy, they can grow. And actually, they are usually circular, but they can grow into different shapes and can enter the cavity. And when they do enter the cavity, that's when, now it depends on when and how this happens. So there can be chances of, if the fibroid is around the placenta, then the placenta sometimes kind of holds onto the wall and gets attached to the fibroid or something. And then there are chances of postnatal bleeding or placenta accreta as a side effect of this condition. Now, so that got me more into reading about fibroids and what happens in a myomectomy. So in this case, she had a myomectomy. That's her history. So she has a small scar on the right side of the lower belly. She was diagnosed with intramural fibroid. There are 2 in number on the anterior posterior uterine wall. So this is what is given. This is the size of the placenta. So now nausea was there, but we went ahead and discussed, and I called her up and asked her what has been her diet like. What has been her diet like? So her diet has been gap between eating and sleeping. So that could be one of the reasons that she worked with the diet, and that got ruled out. So actually towards the end now, the initial work where I started reading up all this was nausea, and nausea got ruled out. Now in a week's time, her nausea is absolutely better by following the diet. Another thing that I wanted to know after this was, did her fibroid increase in size? So I went to her place. This kind of weekend, last weekend, I went to her place and asked her, does she have the reports of the myomectomy? So she brought in with the reports, she brought in the earlier ultrasound. So I was not aware that she had any other ultrasound, because the only ultrasound she gave us was the ultrasound that she had done in the beginning of the pregnancy. Now I had ultrasounds up until February also. So I get to know that she had 2-3 ultrasounds more. And in those ultrasounds, the fibroid was still the same size. So I was reading up on fibroids. I heard Dr. Stu's podcast that I shared in the group yesterday, that a fibroid primarily increases in the first and the second trimester. And after the second trimester, it does not usually increase in size. So this was in February, so I was least worried now about the size of the fibroid also. And yeah, so the only thing that I wanted to know now from all this reading, a few things that came up were even in Dr. Stu's podcast, which was about if the myomectomy is done on the fundus, then there is an issue. Another thing then that came out was, if there is really an issue with the myomectomy, usually the reports say that women have chances of a rupture between 36 to 39 weeks or so. It happens before women go into labor with a myomectomy, and it usually doesn't happen after the labor has begun. In this 1 week, the complaint of nausea has been resolved. One of the other symptoms that Anfly says is of a uterine rupture is really, really hard uterus. Now, that was one of the complaints, that she has a hard, she said, my uterus is hard all the time these days. But then again, these symptoms are usually so interchangeably between normal and what's not normal. In this case, I realized that it was a normal hard. I don't now feel that it has anything to do with it being rock hard, because it did become soft with stimulation. It became hard with palpation. It became soft. So I did kind of note it down for my own reference, but I didn't feel that this was anything to be as worried about as of now. So yeah, my one concern was, where is the myomectomy done and how it is done? So since I started already digging into how myomectomies were done, I found a report. The report is, so this is what Anfly says. My first plan of action after the first diagnosis, I wrote down that if she doesn't have the reports, I'm going to ask her to get an ultrasound done. But she did seem to have the report. So I kind of ruled that out, that I do not need an ultrasound to figure anything out. These were the reports. This was where the fibroid was. So in the YouTube videos and everywhere, I found that it depends, the scar, the section on the uterus is done depending on where the scar is. So the YouTube videos all showed me videos of cutting the uterus. So I did not even know that there are 3 layers that are there. So maybe just 2 layers are cut. So in this, it's clearly written that I don't have the other side of the report. The other side of the report says that the uterus is stitched in 2 layers, and the fibroid that was there is in the anterior section. So Dr. Riddhi and I were discussing, and I kind of messaged a few other doctors I know of also, like how myomectomy is done. So we did come to, and in this report, nothing is written. It's not written where the scar is done. So up until before this, I was assuming that because the general reading of myomectomy says that it's usually a low-line scar and it's very similar to cesarean sections. So I wasn't really taking into consideration. But now after, however, I came into this reading, I got to know more about it. And that's what Dr. Riddhi and I were discussing yesterday. And we realized that, and Dr. Riddhi told me that with a laparoscopic myomectomy, even if the scar is, the uterus is opened, it's not opened, it's not necessarily that it's opened in all layers. And that's what it is written, 2 layers. They were stitched separately, and usually it's a smaller, just an area is opened from where it's digged out. And also Dr. Riddhi kind of told me that if it's a childbearing age, doctors are very sure not to touch the fundus. And I also now understand that most likely it happens, the fundus will only be touched when the fibroid is big enough to be in the upper segment of the fundus. And that's when I think maybe then there can ever be a need. But in this document, they haven't mentioned where the scar was done. So right now, I'm not as concerned. But a week back, I wanted to know a lot more. So that has been my understanding. So I've written all these things. Outstanding questions were, is nausea better? I've written an answer. Yes, with better feeding. It is not continuous now, meaning it's not urgent. Where did the uterus get stitched? Does any of this mean anything? So up until now, I feel it's not something that I'm worried about, because the complaints have completely subsided. Had this been something as big as a silent rupture, it would have continued. It wouldn't have been a discontinued nausea in the very beginning. So yeah, that has been my understanding so far.
I need to get more emoticons. Hang on. Oh, more reactions. I need more reactions. Where did it go? There you go. Oh no, I did that one. This one. And where's there a proud mama one? I want a proud mama reaction. You know, the one with the big eyes. Anyway, pretend I sent it. Oh, wow. All right, I thought that was amazing. Why do I like that? Why do I like that? Okay, so she wrote that document. She put that document, she being Divya. So yeah, Divya's been looking into this question for a while. She's been, what, how long has this been? 3 weeks, I think, yeah?
No, last 1 week.
At least 1 week, but maybe 10 days even.
Yeah.
Maybe even 10 days. So anyway, and in that amount of time, you've really learned a lot, didn't you? Didn't you learn a lot?
Yeah.
You did a fair bit of research and you learned how to follow your nose, right? You kept following your nose, and this is what we're supposed to do. So, first off, it seems to me certain concerns started rising, and you kind of started getting worried, as you mentioned here, with the vomit, the nausea. There is something also not just about if there is something unique about the nausea, which was salty, was it? It's a sour, salty,
Salty taste.
salty taste. So these kind of things started to alarm you. You heard a story from the mother. The mother's telling you a story. Then you hear some questionable things that make you look something up. You spent your time looking this up, and in so doing, you learn a few other things along the way, didn't you? I would assume. You didn't just learn about salty flavored vomit. You learned many other things. So this is wonderful. This is what midwives do. And at the end of it, you came around, you kept looking things up, you kept digging even harder, and you haven't really lost it. But you come to, okay, I'm here at this point now with this type of conclusion after looking at all the information and researching. I'm now coming to a conclusion, which is, okay, I'm okay with this. I'm okay with this. No doubt there's still something there in the back of your mind. You're going to still keep your eye out for it. Yeah, you're already aware. But right now you're cool. You've done all the looking you want. No doubt you're embodying that mood to the mother, meaning when you speak to her, you can talk to her with confidence. Well, I went into it. We spoke. I did have discussions with this person, this doctor and that doctor, and yada, yada, yada. You can give a good conclusion. So this is what a midwife does. This is what you did. So I'm very, very proud of you. Yeah, I'm pleased. I'm really happy. I didn't have to lift a finger. Suits me. Okay. So anybody else want to add to that story or have questions about that story or have a story to share? Or does anybody else want to ask questions of somebody else? Radikund.
I have a story to share.
Do
Are we
you?
sharing birth stories today?
We are. Actually,
Okay.
today is it's an open day. Today's
Okay.
potluck.
Okay. Yeah, I wanted to share my birth story with our mother, Mayapur. Can I share?
Yeah, please. I'm
Yeah.
going
So
to.
as you all know, that was my first catch. Even though I've been skeptical about catches. And I'm very happy that I was given this opportunity to catch this baby. So many good things came out of it. And I'm very, very grateful. Yeah. I feel like really everything was under Krishna's arrangement. Like KL says, Krishna's there with you and he's got you really. And I really saw a lot of his work, and it strengthened my faith my faith in nature, my faith in Krishna, my faith in natural birth and the process. And it's just so beautiful. Yeah, my mother was very strong, which made it a lot easier. And yeah, she started her labor on Wednesday evening. She said her mucus plug was releasing. She wasn't having contractions yet, and she wasn't sure if it was labor or not. So I told her, you know, it's okay, just go on about your business and let me know if contraction starts. I asked her if there was any leak with it. She said no, there's no leak.
So I just want to pipe up at the moment. That was the mucus plug. We shared that photo of a particular mucus plug that was.
No,
Oh.
no, not this was before that.
What did you? Oh, okay.
Yeah. So apparently,
But still, yet that mucus
some
plug
before.
that you shared was
That was
hers,
a
right?
big one. Yeah, that was the next day. Yeah,
Okay.
that was the next day. Yeah, so I did tell her I would come see her later. I'm trying to remember if it was the same night I went there or not. In the evening, I went just to peek at her. Yeah, it was the same day I went peek at her. She was doing a maha cleaning, and every now and then she would go up to her rooftop and do some walking and squatting. And her contractions weren't so much. It was very, not more like a menstrual cramp. It was very, very mild. And she was just enduring, like you could barely even know she was having any contractions. It was definitely far apart. So she was still cleaning her bathroom and all that. So I just, went there, observed her, and then went home. Told her to make sure she eats and rests since she's been working hard that day, and make sure she just rests properly. And hopefully we'll, be getting more contractions the next day. And then the next day she sent me a message saying her contractions picked up, but they're not as strong. In fact, she couldn't sleep the night before. So she's pretty much been up, and I told her I'll come see her that morning. And when I went there at 7, she was, riding the wave. She was exhausted. You could tell she's very sleepy, somebody who's been up all night trying to labor. And I kept encouraging her to go to sleep, rest, eat if she has to, and just, relax. No need to stress, no need to worry. When it's ready, it will come. She tried to do that. She was not hungry. She started getting nauseous actually that day. And so she wasn't really hungry. So she didn't eat. She tried drinking, but still got nauseous. I was there for an hour and a half. And while I was there, her mucus plug released. That big one I showed in the picture. It was all intact. There was no blood. It was just, and that happened after she went to use the bathroom to pee. A while after that, her contractions,
You froze. It disappeared. Or did I? Who's gone? Is it her or me?
It's her.
Okay.
Yeah.
Oh, bummer. Well, I know the story. Any questions up to this point? Okay, she's gone. Who's here? Okay, okay. Oh, good. I guess because I know the story. Want to hear the rest of it. Well, the main thing is that this is Rodikun's first catch. She caught this baby. I wasn't there. So again, I feel like a proud mama. There she is. Going. They're anxiously waiting, Rodikun.
Wait, how long have I been talking? I just realized. No, I did see that it was reconnecting, but like, where was I? I don't know how much anybody got nauseous.
Okay, the
Okay.
mucus plug. You got to the house and then the mucus plug that you sent the picture of, that came.
Gotcha. Perfect. Okay.
Okay.
Okay. So
Nausea,
that's pretty
that's
much
right. She was feeling sick, but she was still going around cleaning the house, right?
not the next day. The next day she slowed down. This was at 7 a.m. She slowed down. She hadn't slept the night before, so she's tired. She's not cleaning. That's the same day she got nauseous. This was on Thursday morning. She got nauseous. We released her mucus plug. And so I went home, told her to let me know if it picks up any stronger, and I'll be right there. So she said, okay. And she did not
Can you show
message me till 3. At 3, I asked her how she was feeling, if it's picked up anymore. She said, no, not really, just the same. So I said, okay, if it picks up, just let me know and I'll be there. And while she was preparing for this labor, I was also preparing at my house, cooking big pot of khichdi and, getting my household affairs in order to leave. And I was even able to take a nap, catch up on laundry, cooked and all this good stuff. So I appreciated that time, being able to prepare for all that and be relaxed. So at 3, at 3, she said the contraction reported that she vomited. She's been feeling nauseous this whole time, but she vomited. So I said, okay, I'll just come and see. After I updated her group with KL and Induleka there, I mentioned that she's vomiting, and KL said this could be a sign of transition. So I said, okay, I was gonna go there and check on her and see. So when I went there, her contractions has picked up. She was vomiting. She had tried to eat a spoon of khichdi, so she vomited. So she's been nauseous this whole time, but it's been okay. But as soon as she ate something, she vomited. She was trying to drink this lemon salt and sugar drink, electrolyte type drink. She's been drinking this the first week before her labor because this mom feels faint. Okay, during her pregnancy, she reported signs of fainting a few times. So that drink, she said, has been helping her. So I encouraged her to continue drinking this drink during her labor, and she tried to do that, but she was nauseous and couldn't keep anything down. So nothing was able to stay. So she kept vomiting, and after she vomited with the spoon of khichdi, her mom offered her a bowl of pasta, which is her favorite. She loves pasta. She was skeptical about it until she tried a spoon, and she was like, oh, that is so good. I want more, So she ate more, and she was trying to keep it down, and she laid down. She was really trying hard to keep that pasta down. But eventually it all came out. It all came out. she did not want any massage at all. She was one of those moms did not want to be touched. So all I did was sit there and encourage her. While she was laboring, by the way, I had a talk with the husband and her mom. When I came, I told her, the mom, I told her, they can speak English. So it was a really good advantage for me. I told her, look, I love you. And I've loved you from day one and still love you. And she was like, okay, but, and I say, but the moment you start to baby her in that room, the moment you start to go there and make her feel like, you know, project your fears or whatever on her, we're getting a breakup. And she was laughing and she was like, yep, she got it. She said, actually, their tradition, they're not supposed to be in the room, according to their tradition, when the mom is laboring, for the mom herself. So, and she explained that this is a hospital setting, by the way. I was like, oh yeah, I can understand hospital settings. They don't allow you in the room. So, but I had doubt that she was going to keep up that tradition in the house. But yeah, she assured me she's going to be cool. So I took her by her word. I also told the husband, you know, you're not allowed to get scared or, you know, freak out or anything. You just, all we can do is support her and be there for her, you know. And when it's time to rest, I expect you guys to leave. If I leave, you leave and you let her rest. And they all agreed. You know, we were working very good as a team. This mom was very busy around the house doing other stuff. She was really good. She was really good, supportive, and you know, whenever she was needed, she would come. The grandmother and the grandfather eventually came. This is the mom's grandparents. They came. But they were also really cool. They just checked on her the first time and then they went to the living room. This was nighttime they came and they just went to sleep. They went to sleep in the living room. Really cool. The mom, I kept trying to encourage her to rest, to sleep, you know. She was trying to do this, but whenever a contraction would come, she'd get up and ride the wave and try to go back to bed. And she was doing really, really good. She was breathing nicely. She was not stressed as in her, she was not fighting the contraction, you know. She was playing her favorite music. They were playing Neshima Stotram, Nechima Kovac Sotram, and she was feeling relaxed. She was breathing well. Yeah, she was even able to chit chat between contractions. So, but whenever I want her to actually sleep, like, let's leave the room, turn off the lights, and just let you go to sleep because you haven't slept the whole night and your body's gonna be preparing for a big job. So let's have you rest. I would notice they'll sneak into the room. It's just, they can't help it. They'll sneak into the room. And so the second time I busted in on them and I looked at both of them, the mom and the husband. And I was like, well, what are you guys doing here? She's supposed to be rested. And immediately the husband was like, she wanted us in here. They ran it on her. He was like, you know, I think we're helping her get distracted because she couldn't sleep. She said she couldn't sleep. And the contraction comes, she jumps her up and she can't sleep. So we're just here trying to, you know, support her and distract her. And the mom was on the bed in the corner. She's like, oh, I'm not saying anything. I'm trying not to say, she actually tried to say, you're doing a great job. And then she caught herself and then remembered she was not supposed to be saying it. And then she said, oh, I'm not supposed to say that. I said, no, please. You can say that. You can tell her all the good stuff. You can tell her she's doing a great job. You can encourage her. That's allowed. Just the opposite is not allowed. She was like, okay. So she was very happy that she could still do that. So she was very good at that. Her husband was really good at that. turned out he has also been reading and watching videos on how to support his wife during labor. So he's learned a lot about encouraging her and being there for her and just saying positive things. So they were really good at that. She was feeling positive and she liked her surroundings. She was happy with her environment. With initially they weren't gonna have the husband there because traditionally the man cannot be there when the woman is laboring. But at the same time, she needed his support. So he was like, okay, whatever you want, I'll do. You know, if you want me in here, I'll be in here. So that's what he ended up doing. The mom was not going to be in there, but then they ended up in there. She was happy. So she was happy. I told this mom, okay, whatever you want, whatever your body is saying, we will listen. You know, if you want them in here and you're fine with it, then it's okay. We'll have them in here as long as they're not stopping your contractions. So she said, no, they're fine. So we allowed them there and they were doing great. They weren't like scared or projecting it. They were just doing really great. The phone kept ringing because her dad was coming from Bangalore. So the phone kept ringing. The grandpa, this is the during the day, her phone kept ringing and the parents, the grandparents, everybody was calling. Is the baby here yet? And she was like, turn the damn phone off. I was like, yes. So I got out all the phones and took them all to the living room. So I had the husband stay there and take care of all the calls and all the phones. So it's not stressing. She just didn't like all the ringing from one foot to the other. And the father would call and ask, how much time do I have? He was at the airport. How much time do I have? You know, my flight is delayed. You know, he was kind of worried he would miss the birth. And her mom was saying, oh, you're fine. Just take your time. You know, and then he kept asking, when is the baby going to come? And she's like, we don't know. You know, we don't know these things. You know, it's just when the baby comes, the baby comes. I was like, yeah, you're in our team. So she was just, you know, telling this husband that just come, you know, just come. Don't worry about when. Don't freak out about rushing or just come. Take your time and come. And so he did that. And yeah, at nighttime, about 10, I was already preparing her to go to sleep since 7, you know, and it's not really, she was already at second stage at this point, and she was not really going to sleep. And then at 10, I, you know, asked her again, we're going to leave the room for the second time and you rest, okay? And she said, yeah, she would like that. So we, you know, went out, turned off the lights. And she tried to, you know, be in the room by herself for a while. Husband said he would stay there because she sleeps better when he's there. So I said, okay, you sleep next to her and, you know, you two just snuggle together if you can. And he passed out on the job, which was expected because he also didn't sleep very well the night before. So he fell asleep and he passed out in the corner like a snug little baby in the corner. Because whenever she get a contraction, she'd get out of bed. That was her routine. Was she would get in bed, spread her legs open, like she would sit on her knee. And when contractions would get strong, she would get out of bed, walk it off, breathe, and then get back in that position on the bed. Either she's sitting on the bed or she's lying down, but she was mostly on her knee. I'll share some pictures of her position. It was the best position for her for labor. And I encouraged it, you know, she was doing good, picking up contractions. So I left her there. At 12 midnight, she comes to me, wakes me up in the living room. I'd already fell asleep for like an hour. Mom was not going to sleep because she was going to stay up and wait for her husband because apparently she still had energy for some reason. She said she's not worn out yet. So I was like, okay. So 12, she comes to me. She says, Radhakund, what is this? Her belly had not concave. Like it's no longer a round, smooth bump like it was during pregnancy. It's now much higher at the top and flatter by the belly button. I don't know if anybody has seen that before. She thought it was interesting, it was weird, you know. I mean, at that point her contraction had picked up even more and she was getting more restless, and you know, she felt like crying, but she was not crying. And she kept vomiting still, kept getting nauseous and really bad. She was feeling. So at this point, her contractions were picking up 1 to 2, and it was, every 1 to 2 minutes, it would pick up. And at 12, I was inside, you know, husband was already asleep still. So it was just me and her mom. We were watching and observing her. So with her contractions being between 1 to 2 minutes, she'd fall asleep between the contractions. Like she would literally like doze off, and she the mom is thinking she would probably fall off while she was dozing off. And I was saying, yes, this is what I'm talking about, sleeping in between contractions. You guys keep saying you cannot do it. Look at her, she's doing it. She's literally sleeping. She's dozing off between contractions while she's sitting down, you know? So she was doing this for a few minutes, and it kept getting stronger and stronger. And within an hour, I could notice her urge to push it's quite subtle. It was not as obvious. So I just, you know, just lifted up her dress just to see what's going on there. Oh, by the way, I'd done an internal in between at 9 p.m. I did 2 internals to check how dilated she was before I went to sleep. She was 7 to 8 centimeter dilated the second time. So I figured she still had time, so I went to sleep. I went to sleep at their house because she was 7 to 8. So Krishna Lolia encouraged me to not leave since she's still pretty close. So I slept on their couch that night just for an hour until 12. Her contraction picked up, and she was in transition stage for sure. At 1, she was lying on the bed and was getting ready to push. We could see this beautiful moon while she was pushing, because her water never broke yet. So she had this beautiful moon-like crowning, you know, and it was so beautiful. We were getting ready for a big splash on our faces. And then I called Krishna Lali at that point, and she was able to watch the birth and instruct me on what to do. I did call her earlier, and she instructed me on an internal, the first internal, my first ever PE exam. She talked me through it, and I was able to learn a few things. So I did it the second time, like 3-4 hours later before I went to sleep. So I called her back for the second time to witness the birth and talk me through whatever I'll be missing at that point. So we were just watching her push and, you know, encouraging her, and she was so happy. Finally, she found blood, and finally she's, you know, at this stage she's been waiting for. She started to push. With every contraction, something happened, which is great. And her water broke, but her water just spilled on her mat. It didn't like gush out like we thought and like spread all in the air and showered us like we thought. So it leaked very nicely. And as soon as the water leaked, the baby's head immediately came out. It immediately started crowning. So she was like, "Oh, I could feel it. The baby's head is coming out. Oh, I'm gonna tear it." And she was talking through her pushing, in between her pushing. She was just so excited, and the baby's head would come out, and Kale encouraged me to support her perineum, and I was doing that and giving massage in between, just around the outside of her perineum, and baby would come out. He came out. It was just the coolest moment for me. You know, I've watched the baby being born, but being on the other side, in between the mom's legs, and watch this baby right in front of me do her internal rotation. It was so cool. It was so cool. And the Kaya told me to support the baby's shoulder because she's gonna birth one shoulder and then the other shoulder was gonna come out. Just being able to support that and see that happen, it just gave me such goosebumps. So excited. So I did that, and after the baby rotated, one shoulder came out and the other shoulder came out, and I cut the baby. The cord was wrapped around his foot. Just twice, just loosely, untangled that. He cried immediately. He came out. He cried. He was blue. And after untangling the cord around his foot, I placed him on his mom's chest. And immediately he stopped crying. I encouraged her to take her bra off so that she can have skin to skin. She was so happy. Like, you know how some moms need a minute. She did not need a minute. She was ready to get that baby, embrace that baby. She was just so ready for that. And she was just so in such awe. And she was telling the husband, come here, come talk to the baby. The husband, by the way, he was already freaking out, and he was so overjoyed. He was on the floor, he was crying, he was just so overwhelmed with joy. And she was telling me she wished she'd recorded that. He was just so happy. He was thanking God, and he was paying obeisance. He was just so overwhelmed. And she was like, get over here, come talk to your baby. And he came over and he was talking to the baby, you know, baby voice. Baby was so he opened his eyes and he did turn towards the dad's direction, actually. He opened his eyes and it was just so peaceful and so calm. And the father was touching him. It was just such a beautiful moment, you know. Mom did not bleed almost at all during this delivery because the amniotic sac popped and the baby came out. So I thought a lot of the blood was probably behind, still behind, since the baby just came out straight from the sac. So I figured, okay, a lot of blood is probably pulling behind. So she barely had anything on her mat. And so I did not rush her to nurse the baby. I just left the baby on her chest and waiting for the baby to start showing signs of hunger to make an effort to start nursing before we would start telling her how to or what to do. So I just let them have that moment and just cherish that moment, and they savored it. It was nice. So I had to be alert and pay attention for her placenta. As beautiful and as involved as I wanted to be, I just had to let them, have the moment. And I was trying to encourage her to birth the placenta when she's ready. She was getting contractions, and eventually baby started nursing. So she was getting contractions at every nursing. And I told her if she felt the urge to push, she can push. And she was like, again, I don't want to go through this all over again. I was like, I know. She asked, like, what is the risk of leaving it in there? Can I just hang on to it? It's like, you are more than welcome to hang on to it for as long as you want, but you don't really want to hang on to it. You really want to get it out and just move on. And she agreed. She actually did want it out so that, because the cord is still connected to the baby, she really did want it out just so she can be mobile and just be done with the whole thing, So within an hour, she birthed the placenta. I did wrap around the cord and check for traction. And I tried that twice and it was not, it hurt, so I let it go, waited until a few more contractions, and I saw her actually pushing. So then I went there to assist her. At this time, it was already ready to come out. So I helped her while she was pushing, I helped pull it out. And she was so relieved. She's like, ah, finally it's all done. All the contractions is gone. Everything stopped. It was just a moment of relax, like, oh, finally, it was beautiful. So I encouraged her to go to the shower and go take a shower. And while she was gone, she took a shower and had her pad and got all dressed up. You could tell the moms, they have this surge of adrenaline after the baby's born. So I did encourage her to still take it easy. Her mom was impressed that I had her go take a shower. She said she remembered her own birth. They gave her a towel bath, which she did not quite appreciate. She would have loved. She actually did say she took a shower, but they came back and say, no, we still have to give you a towel bath, which she did not like. She felt like she'd already done her cleaning and all that. And it's like, is this towel bath you're gonna give me better than whatever bath I had already had? She didn't quite like that. So
that's what the doctors here recommend, that you don't. That's what happened with one of our mothers who birthed in the hospital. They were trained not to use the water. Meaning,
Gotcha.
sponge bath really is what they would call it in the West, a sponge bath, I assume. But like, he didn't want his wife to, that was the protocol here, was they were not to take a bath, especially they don't bathe or wash down the genital area, which is like the exact opposite for me. That's, no, you actually go have a shower and wash yourself off, Yeah. So go on.
Yeah, so the mom appreciated that. And she came back changed. I checked on her tear. She had a 2nd-degree tear. I told her she can either go get it stitched or she can keep her legs closed.
No, that's not a 2nd-degree tear. That was a 1st-degree tear. What made you think? Okay, so a 2nd-degree tear isn't the length of it.
Half.
Yeah.
Yeah, half of her. It went all the way half to the middle of her perineum. It tore pretty. I could see her muscle. Her muscle separated in between the. I didn't quite open it when I showed you that picture.
Oh, you didn't open it all the way. So when the muscle, so when you see muscle, what do you think it looks? So muscle, when it breaks, the fiber actually kind of protrudes. So you've got torn tissue on either side, and you've got this fibrous thing poking out here and a fibrous thing kind of. So you saw that, did you?
Yeah, but hers leg was white. I saw a set of 2 on each side protruding out. Is it supposed to be white?
The under layers, the subcutaneous layers of skin tend to be whiter, pink actually. And in fact, when you have a dark-skinned lady, it's quite startling. It stands out.
Gotcha.
Yeah. So I didn't see that within the photos. But anyway, go on.
No, I didn't open her up enough for you to see that. I didn't want to aggravate it more. So I told her she could either keep her legs closed and it will heal within 3 days to a week, or she can get it stitched if she wants. She's like, nope, do not want stitches. I'd rather keep my legs closed. I don't want to go through anything else going up there. Just like I thought. So she was happy keeping her legs closed.
Do you remember do you remember their postpartum concerns? Do you remember? Were you there with it? They're concerned. She wants to go back to work in 2 weeks, right?
Oh, yeah. They were talking about that and asking me if there's a chance that she could go back to work, because she's a photographer, a videographer. So she helps her husband as well. They do wedding pictures and videos. So her husband is also depending on her for help, So He's pretty much waiting on her recovery. So, but they were hoping like one of the wedding would be canceled, so they wouldn't have to go for this shooting. And one of the couple was supposed to be coming from Dubai next month, so she's already got two things next month waiting for her. One will be in a few weeks, and the other is next month. So, husband is just waiting. And I was telling them I hate to burst your bubbles, but she's gonna have to rest, you know. She cannot pick up anything heavier than her baby after delivery. So they were understanding, and I figured after she's delivered, even her body would tell her what to do. Her body would tell her, you know, you really cannot go anywhere. You cannot, you know, she would listen more to her body because she was that kind of woman that was pretty intuitive with her body. You know, she was paying really close attention to what's going on. She wasn't complaining about it. She was observing, and she was going with the flow and listening really good. So I think during postpartum, she will not have any issues resting or just listening really. So yeah, after the baby was born and placenta came out, we waited for an hour and a half to 2 hours until the husband wanted to cut the cord. He didn't want to. They asked if they could cut the cord. Now at this point it's white, and I said, sure, if that's what you want. I'm happy to wait longer if you guys want. They say no, we'll just cut it because they just want to be able to carry this baby around, you know. The grandparents had woken up. Everybody was at the door listening to her birthing the baby, and they were all excited. Everybody just wanted a turn to come inside and celebrate. So we had to cover the mom up and just give them a minute to celebrate. And so this baby has his parents, which is the mom and dad, his grandparents. Oh, at this point, the dad had come back. The dad came back at 12, an hour before the baby was born. Yeah, so he made it right in time for the birth. Of course, he was not allowed in the room, so he waited outside. So grandparents was there, and great grandparents of this baby was there. So it was really cool. So the baby is really blessed, and these great grandparents are really strong. Like they're 80 and they're upright, and like actually they have a very extraordinarily strong gene, more stronger than you know, folks their age. So that was awesome. That was really cool. So we cut the cord and I let them have their time together while I went to the living room and filled out some more on the file. I couldn't fill out everything. I was tired. I figured I'd finish it the next day. So what I was doing was I was putting a lot of information on her group as an update, so that when it comes time for filling out her file, I will have everything accurate, time and everything there as a timeline. So that was how that birth went. It went great. And I would say, in my opinion, it was textbook perfect. It was awesome. And I wasn't exhausted because I felt like she didn't want a massage. So that saved me energy. She didn't make a lot of a mess. I thought she'd have a big splash on the floor and her water would gush out and everything. She did not have a mess at all. She like barely had any blood out. Even with her placenta, she just had a cloth, a nice clean cloth came out. And that was it. She had less than 1 cup of blood in total from her placenta and the birth together. It was just pretty impressive. Their mattress was obviously saved, which is something they were really grateful for, and upset at you for KO for not sending a plastic sheet. But they were really grateful, and they felt like, oh, thank God. They really did not want to go through changing a whole mattress and all that. So yeah, that was how that birth went. It was great. It was perfect. She's healing well. She's breastfeeding well. she's contracting. Her uterus is contracting as she's breastfeeding. They're super happy. She told me postpartum day one that she was really happy with her birth. With the delivery. The delivery, she said, was her favorite part. Not so much the contraction phase, but the delivery, the moment, the transition stage, she said it was magical for her. And it's something she'd want to experience again. And I was like, you remember how we say in the Bhagavatam, the three kinds of people in the Bhagavatam, the thief in jail who says he will never steal ever again, the baby in the womb who says, I'm never taking birth again because this is horrible, and the pregnant woman who says, I'm never gonna go through labor again because this is horrible. And then just hearing her the next day saying, I would do this again. It was awesome. I didn't think I'd hear her say that for another year or two. But she said, yeah, I would totally, she just really liked that birthing stage, and she was in such awe about it. So yeah,
Well,
husband was very happy. And yeah, everything went great. Supportive family and supportive. They were not your average Indian, they were more exposed, more educated, and more relaxed.
They're more traveled. They're more
Yeah.
they've traveled more outside of India. That's why too. And he's
Exactly.
educated in Gurukul. So in ISKCON Gurukul, which is international, so you end up, getting a lot of contamination.
Oh yeah, absolutely.
Oh yeah, she knows. Oh yeah.
Yeah, so that was my birth story. I'm just so grateful and so happy that I was given this opportunity to learn so much and be a part of her journey and that birth. It was magical. And I never thought I would be there so soon, but
Mm.
I'm so grateful. Yeah, I'm so grateful. Yeah, actually, with every birth, I feel more grateful and more, I just love it more. I feel more drawn to this. I feel more attracted and more empowered in a sense. It's like it's really inspiring for me. Thank you so much.
No, thank you so much for sharing that. And so you also mentioned something afterwards, the discussion about the placenta. And I think I think we kind of discussed it a bit in this group, did we? We discussed the placenta, how it felt. You sent a video of it, of you examining the placenta, or you mentioned okay. How about I ask you? So when you went to examine the placenta, what number placenta is this for you? How many placentas have you seen before?
I have seen 4 placentas. Yes.
So is this
4
4 or 5? Is this 4 or
number
5?
4.
Okay.
Number 4.
All right. So when you saw those other placentas and you see this one, you had something to tell me. You described the placenta to me. So please describe what you found and what you thought was interesting about this placenta.
Okay, so when I was examining this placenta, I felt like the amniotic sac was a little weak. Well, this was the next day also, okay? And I wouldn't say next day. It was because baby came at 1 a.m., right? So at 12, I went back to check on the mother and the placenta. So I would say this is a few hours after the placenta was born. The placenta, the amniotic sac at this point is a little weak. It was tearing very easily, like without any effort. I found a lot of white in between the placenta, the amniotic sac. I wasn't sure if that's calcium or not, but there was no calcium on the placenta itself. This mom is 38 weeks. There was no any outstanding calcium deposit like I've seen in other placentas, just in between the amniotic sac. So I wasn't sure if that was calcium deposit or not. Her placenta was not as smooth as the other placentas that I've played around with. Oh yeah, this is the 5th placenta. Now I remember. Missed
That's it.
one month. But yeah. Yeah, her placenta was not as, it was bumpy. It was bumpy. So it made me really carefully check around it and investigate to make sure no piece was torn out and left inside of the mom. Because her placenta seemed like it easily would just, you could tear a chunk off. Unlike other placentas, I've seen Kaya really dig her fingers in there and they're like so tightly woven. Her placenta was a little bit more on the chunky side. I will probably share a video on that.
Yes,
little
yes,
bit.
please do. Yeah, if you can.
You just tear it off easily. I didn't feel very confident about it, to be honest. But baby looked fine. Baby looks healthy. Mom looks healthy. So I figured, okay, just not gonna say anything to the parents. Baby's here already. They don't need any more information on placenta, on the health of the placenta. So yeah, just between us, I was just curious if that is a normal thing to see on the placenta. I wanted to say the placenta was getting close to falling apart, but not quite there yet. But yet there's no calcium deposit, to tell me that this baby's overdue for 38. So
Okay,
just
well,
left me
actually,
with
I think the
water.
baby is, I thought it was like 37 to 38 weeks. Yeah, go ahead, Newton. You have a question. Go ahead.
She said she just gotten into 30.
Oh, getting in. Okay, coming up to. All right.
Track. Yeah.
So
Okay.
what was the white thing between? What was it? Yeah.
Okay, so Radhikun, to be clear, to clarify, you're mentioning the white deposits, not deficits, deposits. So on the placenta, especially if they're starting to get older, and actually when you see a placenta, usually you'll see a few calcium, you might see a few calcium, what's called calcium deposits. And there's a difference between, and there you find them in the placenta, which indicates, okay, the placenta is aging, it's time to go, it's time to birth the baby. And then there's something else that are fatty deposits. When you look into it, it's made up of, fat, sometimes skin cells, and even skin cells from the baby. Sometimes it's their bits of hair, they're things. And these can be found in the membranes. So I think what I'm hearing from Radha Kund is that as she lifted up the membranes, number one, you make the comment that they were thinner, they were more fragile. You make the point that this is a few hours later, so you're wondering if it was aging and getting weak, and that's not, they don't get weak like that. They're actually, membranes are amazingly strong. So what I found very interesting, the overall summary of what I hear from your placenta is a malnourished placenta. This placenta is not, loved hearing about this birth story. Yeah. You also mentioned, and it's true, that she often felt weak, that she fainted. Now we look at her diet, and her diet was great, and she was a strong woman. She was also not just strong, a very active woman. They both are videographers and they do a lot of documentaries and bloody blah. And so they do a fair bit of traveling and they carry a fair bit of equipment. And so this whole pregnancy long, she's been very determined to continue to work carry her equipment and go about, throughout her pregnancy. And then again, last time before she gives birth, she's saying, I want to get back to work in 2 weeks. Now, anyway, I want to get back in 2 weeks. So I look at the report of this placenta. It sounds malnourished. This baby came earlier rather than later. Indeed, the baby's healthy and fine. But, placentas tend to correlate health, the status of health, right? A healthy placenta indicates a healthy mother and a healthy baby. A not so healthy placenta indicates an unhealthy malnourished placenta indicates, indicates a malnourished mother and or baby. So sometimes if babies don't feel like they're getting enough food from the mother, they decide to leave the womb. There were studies that were done during Ramadan where many Islamic women choose to fast. And during this period of time, there's a rise in premature labors and deliveries. If you're not going to feed me, I'm coming out and looking for food somewhere else. The placenta can't maintain you. So they spit you out. So, Radhakund, I invite you to come over and grab some of these, 1 or 2 of these medical books if you don't have any on your own. Yeah, definitely. Yes, definitely, Divya. Just 1 sec. I invite you to look this up. Go get a medical text out and look at the anatomy of a placenta. Look at how it functions. And when they have find out everything you can find, not just from, we've talked a lot about, about the chakra of the placenta. We've talked a lot about that. Now, just as we have to understand our bodies, we understand, we're great, but we need to understand how the body works. We need to understand how the placenta works. Go look it up. Go look it up and try to see if you can get a little bit of an understanding of what happened in this situation. Might be very interesting. Okay, cool. Divya Kanal, love to hear. What do you reckon? What do you got?
So I was waiting on another mother who was due around the same time as Shravani, and she birthed on Sunday. So that's what I wanted to share about.
Do you want to tell us a story?
Is it okay? Do we have time?
Yes. Yeah.
Okay. So thank you so much, Radhakund, first for sharing such a beautiful story. It is a little contrasting, or rather very much contrasting to this birth. So I'll just go from the beginning. Now, this mother came to me for hypnobirthing sessions because she said she was very afraid of anything going in or coming out of her vagina. So this was right the beginning of her pregnancy. And I've been meeting her even before she got pregnant, actually. So, this is a very conscious conception with a lot of preparation because of this hesitancy she had. She didn't share why and when it started. But she was just that, I don't like anything going in and coming out. And that's why I want to prepare well and, see what we can do to the best possible extent. So throughout her pregnancy, along with all the sessions, she also did a lot of relaxation exercises, and she was very active, absolutely healthy, and quite tall, both husband and wife were quite tall. So, very chill couple. And past her due date, was it 41 weeks? She was going to a regular hospital, and the moment she crossed her due date, they started, we have to get you admitted for induction. So she said, I will sign whatever you want. I'm not coming back till labor has started. So she just, signed the papers, and both husband and wife came back, and they were being intimate and, doing nipple stimulation at home. And I think within 2 days of that, her labor started at almost 41 weeks. I think it was good. The full moon was bringing a lot of babies around, I guess. So her labor began on Friday night, on Friday evening or so. We had a nice full moon meditation in our community, and she came for that. So we sang a lot of songs and bhajans and all of that. So she was a part of it. And, in between, she would get up and move around a little bit whenever she had a contraction or surge in between. And she'd come back and sit and join in the singing and all that. So that was how her Friday evening went. Friday night also was a similar pattern. Saturday, contractions continued. She was laboring at home. And Saturday night, it started getting intense. So that's when she was like, now I really need your help. I don't know what to do. It's paining a lot. So I was on phone with her, supporting her on the phone, because I was also out another place, just a little far away. So I was there, and she sounded like she was in early labor. So I was like, I didn't want to rush over early and then get burnt out, so that when she needs me, I don't have any strength at all. So they both managed. She had a bath a couple of times in the night. They have 3 dogs. So she was, hanging around with her pets and just going along with the surges. And it started getting very intense for her, but she was coping well. And they were, both of them were up almost through the night. A couple of hours her husband slept, and she managed on her own. But otherwise, she didn't sleep as well. So Friday night she didn't sleep, Saturday night she didn't sleep. And Sunday morning she was like, okay, now I can't take this anymore. That time her surgeries were coming about 2 and 5 minutes. So she's like, okay, I want to go to the hospital now. And she and her husband came there. I met them there. So when the midwife did the check, she was around 6 centimeters and the internal in the hospital. And I was supporting her with Rebozo and some essential oils and all of that. And she was laboring very nicely. We climbed some steps. She was using water. And I think in about a couple of hours, they offered if she wanted to go to the pool, the birth pool, she could go. This was around 9, and she was making sounds like as if she was pushing. So we entered she went to the water pool at around 10 o'clock. And we all thought that by 11 she would birth, because, she was sounding so close to giving birth, and she was making all those pushing noises and, moving her hips in that squatting way. Like she couldn't stay erect. She'd walk 2 steps, then she would go flat, squatting, and make those movements with her, hips around. So when she went into the water, the midwife also checked again for dilation. This is about a few hours after she checked her, about 4 hours, I think, since when she checked, and she was fully dilated. So she was like, okay, wow, now, if you feel the urge to push, you can push. There's cervix is fully open and all of that. So from around 10, she was in the pool and, trying different positions on her own, trying to push in different ways. And this went on for about 3 hours. And we could see that, she was visibly getting exhausted. She was sweating so much. So around 2 o'clock, then literally from 10 to 2, for almost 3.5 hours, she was in the pool trying to push this baby out after being fully dilated. So, then we suggested that why don't you come out and, try outside, maybe a different position or something might help. And, she was like, tell me what to do. I don't know what to do. I don't know what's happening. I don't know what I need to do. How do I get this baby out? So she also kind of was not able to figure out what to do. So I mean, I was telling her, it's okay, you can just breathe and move around, and, you can, your body will help you out of this. But I think she started panicking a bit also at that time. So then we did a couple of different rebosos because they kept on saying that the baby is at 0 station, she's fully dilated, but baby is not coming down. So I mean, the midwife was like just standing. They didn't really help out in lunges or in any kind of rebozo. Me and her husband were trying to help this mother. And I think we did a little bit. The doctors came and they were like, okay, now we need to check the baby's heartbeat. It's acute bradycardia or something, they said. And that she's been dilated for about 4.5 hours, fully dilated. So they need to support her with some instruments. And she was also feeling very exhausted. So after all this while, they moved her to another room where the doctor used a vacuum, and finally at 3:23 the baby was born with the vacuum assistance and a huge episiotomy. So I was just, the mother and the father are happy with the outcome. The mother is like, yeah, I couldn't do it anymore. I was totally exhausted after not having slept 2 nights. So they're happy with the outcome. They had a baby girl, a 3.5 kg baby girl. So everything is good for them. But as a doula and birth keeper being there, I just wanted to know, because I was at another birth before where the mother was fully dilated for this much time, but with rebozo and the sifting action and stuff like that, the baby did come down. Here we even tried climbing steps. We did some 4-5 floors a couple of times, and the baby would come down, but with the contraction, but go back in. So I don't know what was happening or what could we do differently or what was the trouble here. That's why I wanted to share here to know what could be going on.
Thank you very much for sharing. It's not unusual for us to hear this. And in fact, as you were saying it, that word we start hearing again, I was exhausted. There's being tired, and then there's physiological exhaustion. When you're physiologically exhausted, meaning your body's actually exhausted, your contractions stop, and it gives you time to recover. I've given that example before. They show you that example. If you just keep lifting weights, after a certain amount of time, your muscle will actually give up. You actually won't be able to lift that weight up again. The physiological explanation, the chemical explanation is your body requires glucose to do this. Everything it's doing requires glucose. It runs out of glucose. It can't do it. It just can't lift it one more time even. It can't. So it stops. It can't. Same thing with uterus. When the body is actually tired, it'll stop contracting. It'll give you time to rest. Now, this is a woman who was, of course she was up. I was exhausted. I was up all night. How many of you have been up all night before? Have you partied all night?
Yes.
Have you had to wrap Christmas presents before? Stay up all night? Okay, different cultures, different plate strokes for different folks. But how many of us had to stay up all night for one reason or another? Not just labor. Some people stay up even longer. And anyway, I really kind of want to clarify that word exhaustion. I want to remove it, to be honest. In terms of labor, I kind of want to remove it because it's being used in the wrong way. You got over it. You're over dealing with the pain. Yeah, you had to go through the whole night to deal with it, but you got over it. Did you see the vacuum extraction by any chance, Divya? And the episiotomy?
Yeah, I was there.
But is this I gather you would have seen an episiotomy before, right?
Yes, I have.
Okay, and okay, so but this is the first time for a vacuum extraction, right?
No, I've been at a vacuum before as well.
Okay, okay. So those things weren't too new to you. But you're wondering what else could be. Is this real? Okay, so a little more. You say about pushing for or being in second stage for 4 hours. Meh. Again, we've said this. This is average. For first time mother, 4 hours is average. We've talked about women having been in second stage for 12 to 14 hours. Who went, and usually when we talk about this, these are people who've gone, they push for a number, they move around, they're active, they're trying to push, changing position, and then get exhausted and go to sleep for a while and stop working on it. You know, the contractions may or may not keep coming. They may be as frequent or less frequent. But the women will stop working with it and take a break and then get up and get back. Their breaks may not be very long. We describe women who fall asleep. Yes, this is what we talk about. Instead of getting physically exhausted, you just fall asleep in between contractions, and you can do this at any time in labor. It's just whether or not you want to go through it. If you want to put up with it. If you trust it. I don't know. I'd put up with it. So you've seen a vacuum extraction. I don't think I've actually ever even seen an episiotomy now that I think of it. I must have with my sister, must have. Because she had everything. Anyway, what do you think about that, Divya? How do you feel?
So, I don't know if they wouldn't have checked the baby's heart rate so much and gone on, that machine going beep, beep, beep when it was going down and going, I don't know, maybe she would have slept and got on with it like you mentioned, or maybe if we had gone to the hospital much later rather than then. I don't
What
know.
did the room look like?
Sorry?
What was her labor room like?
It was in this place, all the it's like a normal house room. Nothing extra is visible. And she was having coconut water throughout the day. She ate idli for breakfast. So she was eating, I think she had some 8 coconuts. She drank some 8 coconut waters because she's quite tall, and that was the only thing which she
You're
liked.
right.
Yeah, but when they did the catheter, the Foley's catheter, they thought maybe the bladder is full, so baby's not coming. They did that as well. Urine was very orange. It was dark.
Dehydrated.
Hmm.
Mm-hmm,
And she tried pushing in so many different positions, on the bed, on the floor, on the birthing stool, holding this. The baby would come down, go back in, come down, go back in, come down, go back in. And this was happening for literally 5.5 hours before they said acute bradycardia and maternal exhaustion. And they gave a huge episiotomy. The midwife was like, okay, because the doctor was going on telling her, cut it bigger, cut here, cut there. Then finally the midwife was like, the other doctor came in and she said, you move, I'll do it.
Wait, that sounds like more than one cut.
It was, and I mean, the midwife gave a small snip, and they were like, that's not enough to get the baby out with the vacuum, so make it bigger, and it was like.
Well, okay, so of course this is what they do. They rush it out. All right, but of course you're mentioning that she tried, she was active, she was mobile, she tried various positions. So a couple of things to note. You mentioned also about something about the bladder. However, I'm not sure, I don't hear you say specifically or indicate that there's actually a retained urine, meaning that you can see the bladder protrude abdominally. You'll see it poke out just above the pubic bone. But it is a routine that they will naturally do in a hospital, and is to catheterize a woman as soon as they walk in.
They don't
Uh,
do it here.
Oh,
They did
interesting,
it here
nice.
only right at the end. They tried this before they tried vacuum and all that. Said maybe this is something that is coming in the way. They
Okay,
kept
okay.
asking her, "Are you peeing?" And she said, "Yes, I am. Yes, I am." So she was peeing also, little at a time, and like this was the last thing they did before they moved for the vacuum.
Okay, so that's interesting because there's a point I've been wanting to make to my students anyway. Is it's good that you identify concerns or potential concerns and potential problems or potential issues. So it's nice that you find them. It's nice that you see them and look at them. You do not need to respond to them straight away. In fact, I would ask you, do not respond straight away. Just take your time. So here's an interesting situation and I understand what they're trying to do. They're trying to figure out, why is this baby not descending? So one of the reasons why there may not be descent is because of retained urine. We've discussed this a fair bit. So in spite of what the mothers told them, which is, no, I keep going to the toilet, I keep passing. And in spite of what the evidence says, meaning they don't see a protruding bladder, they don't see the visual signs of, or palpable signs of retained urine. So just in case they decide to catheterize. So I wouldn't have bothered because we don't have any indication of doing it. And instead we introduce other risks as we do it. So, and it doesn't sound like it helped anyway. What you did find though, Divya, when it came out that heavy color is dehydration. It indicates dehydration. And there is a relationship to dehydration and fetal distress. Okay? There's a relationship. This is why we like to keep our mothers well nourished and to continue to drink, keep themselves hydrated. So
Could 3 hours in the water have made her dehydrated? She was in the pool for so long. The water
well,
was
that's
warm.
interesting, isn't it? Because indeed that's what happens, right? But it actually ends up on your skin. Your skin ends up going wrinkly because it's full of fluid.
Yeah.
It's become edematous. It's absorbed fluids into the skin tissue. And that's why we become wrinkly when we hang out in the ocean, in water, doing the dishes. Yeah, go ahead, Rudy.
I have a question.
Yep.
What is the correlation between dehydration here in the context? Sorry, I can't get it.
For fetal distress, right?
Okay.
So there's a
Okay.
correlation between maternal dehydration and fetal distress. So sometimes when we pick up Divya mentions extreme brachycardia. So we haven't gotten the numbers yet and what's being called extreme brachycardia. So we'll get to that.
So was
But
it low, less than 100?
say
You don't
again.
have the number.
Yeah, it was between 50, 58, then 120, then 60, then 150. It was like going back and forth on the machine.
Okay. Okay, interesting. So that's not extreme bradycardia, actually. That's a variable heart rate. What did you say? What were the upper parameters?
About 180, it went till there.
And then the lower parameters?
Sometimes less than 50.
Right. Okay. And how long? All right. Very good, Divya, that you heard these patterns. Excellent. So were you aware of how long the different like for instance, when it started dipping and continuing to drop, were you aware of how long a period that was?
So she was getting contractions every 1 or 2 minutes. it would go, I think, down at the beginning of a contraction or something. So
Mhm.
between the start and the end of each contraction, it would be at either extreme. That's what I remember.
Okay. Okay. Riddhi, what do you say?
For the variable contractions here,
So I believe we're already in second stage. Yeah, I believe we're in second stage. The mother has been pushing, we're getting around in the hole, she's been pushing for 4 hours. And then the doctor says extreme bradycardia, but Divya refers to baby responds to the initiation of labor by dropping and then responds. I'm not sure how long it takes for baby to recover, but then when he starts to recover, then he goes to accelerated heart rate. So he's
Right.
dropping, going up. And then
Right.
what's the baseline, Divya? Does he have a baseline where he sits happy between contractions?
There was no baseline in this period when they checked. So this was about 5 hours into her pushing. And when they checked, it was not like very few seconds, it was at a steady rate. Immediately the next contraction would pick up, it would go down, it would go up, then a little while, very little while in between, and then go down and go up. And like this was when I think when they checked the Doppler and this was happening, then they said, okay, now we need to put her on continuous fetal monitoring. And that's when they did the belt thingy, it was wireless. So they just put the belt so she could still move around and move to different positions. And the midwife actually, let it go for some time, thinking that probably it's not in the right position, which is why the reading is coming like this. And she tried moving her in different positions or making it tighter so it wouldn't move, all of that. But when this continued for about almost half an hour, so they were like, okay, now I think more than half an hour it went on. And they were like, okay, now we need help you with directed pushing because we need to get this baby out. So they would put their hand and they would all tell her to push a specific way because they wanted
What
the
is that?
baby
Wait.
out.
What does that mean? They would all put their hand. What does that mean?
So the midwife would keep the hand on the inside the vagina to see if baby's coming down or not with the contraction when they would tell her to push, and they would tell her, yes, she's doing great, because they could feel the baby coming down. And then they'll tell her, okay, continue doing whatever you're doing because that's helping the baby to come down. And this they did for about 15-20 minutes. But again, the baby was going up, and then the heart rate was continuing to dip further. And at one point, the doctor also said, now we're going to try vacuum of forceps. And if this doesn't work and the baby's heart rate continues to dip, the baby is going into distress, we may need a C-section. So this was what they said finally. In the vacuum, I think they put that 600 car pressure or whatever, and about 2-3 contractions, the baby came.
Hmm. Okay, well, what that tells me is the baby could make it through the pelvis, right? With more time.
Mm.
Although, of course, do we have time is the question here. Riddhi, do you have anything to say about that? I'm going to answer it. Somebody's just knocked at the door. I'll answer the door. Riddhi, what do you say?
so yeah, Divya, I heard your story. Can you hear me? One second.
Yeah.
Can you hear me? Yeah.
Yes.
So because the cooler is on, the air cooler, so I'm just wondering. Anyways, so I heard your story. I heard the story, and so I was making notes of the story. Basically, contraction came coming and going, and then she was able to um, go along with it. When you reached the hospital, basically the contractions slow down. So whenever we have received mothers in second stage of labor, right here, the contractions, they slow down when they go to a hospital. Basically, slow down or even pause. It's so funny for an hour. I mean, we are not able to feel a good contraction, which she was having earlier. So I was also thinking, I'm just telling whatever came in my mind. And then the second thing is, when she was pushing baby, they thought, was it a cord around the neck?
Yes, there was.
Oh,
Yes, they. Mm.
interesting.
Yeah. How many loops? Like 1 loop, 2 loops, 3 loops? Any idea?
I think there were 2 loops.
2 loops. And
Mm.
was it tight? Was it tight?
No, no, it was one of the thickest cords I've ever seen.
Thickest cord. Yeah.
Yeah,
So
really
that-
fat and thick.
Thick, really fat and thick. Three holes were there.
Yes.
3 holes. Okay, okay. So cord was thick, KL. That's another thing we need to think of. That somewhere placenta was somewhere the cord needed to be thick so that the blood could go from the placenta. I mean, and I feel I would always question loop around the neck in this case because head was coming, going, and all that. It's very so. This explains whatever you said. So whenever the baby was trying to descend, the cord would cord would the pressure would be on the cord, and that's where the distress. Yes, yes, and I think that's the reason. Yeah. Vacuum needed or not, I'm not sure because they were there in the birthing, and I feel midwife and the doctor who's around there in the birthing knows the best. I mean,
Mm.
now they have to do what they have to do. I mean, I can't comment. But
Yeah.
yes, I've seen vacuum. I've done vacuums. Gentle pressure. It doesn't harm the baby. Forceps is what I question. And I really don't like forceps. I mean, I have never used them. I don't want to use them. Vacuum maybe, but you said 600 pressure. So I want to know by 600, like what was the unit of pressure? Because for us, we use 0.5. So I don't know which unit we are talking about. I think you're talking 0.6, I guess.
Yeah, on the machine it was reading 600, what I could see. And the
Uh-huh.
doctor told the midwife also increase it. She kept it at 500. Please put it up to 600. So he put it up to 600.
It up. So maybe 0.5 to 0.6 because we say 0.5.
Okay.
So pressure is 0.5, check. So
Mm.
first we check on our hand and then
Mm.
put it in, insert it. So I don't feel if there were 2 loops and she was trying, and I think vacuum was okay. Episiotomy, you said 2. It happened at 2 places, like so.
No,
So
no,
you
one place, but quite a big one is what
one
was
place.
fine.
So sometimes giving 2 nicks instead of 1. So this
Mm.
is what I have seen in my practice. So let's say 1 episiotomy around half centimeter or 1 centimeter long, on or either 7-8 o'clock position or 4-5 o'clock position. Yeah,
Okay.
okay, that much.
Mm.
So
Mm,
so 1
4
nick. Yeah, yeah. So 1 nick. So if I'm talking about 1 nick, that would be half centimeter, not more than that. It's just a nick. It's like how we open a a plastic bag. We just 1 nick. So like just 1 nick. So it's like not even 1/3. Like it's just the what do you call the starting of the episiotomy scissor. Just that much. So what I have seen and I have also done, I do 2 in case 1 episiotomy is not working. I might give 2 nicks instead of a big one, instead of a longer one. But that is me, and that is because when I was practicing under Dr. Sushma Noria here, she used to give 2 nicks in that case. So it's just what I have seen. So she would give 2 half centimeters instead of 1 centimeter, 2 centimeter. That's what she did. So vacuum, I feel in case of loops was needed in this case. Otherwise, 1 loop, 2 loop, they easily come out. And then, but in this case, because it was getting pressed and the loops were getting, was it also a short cord? Do you have any idea, Divya?
No, I don't think so. It was short.
Too short, no idea. Oh, okay. So you don't
I
think
don't know.
you But were you able to see the length of the cord? Was it looking short?
It was a bit shorter than what I have usually seen.
Yeah. So I would say KL, short cord, loop around the neck. These all were the things. And distress, it's like we also know if we know the cord is around. So usually when the baby is descending and there is variability, but the baby is able to recover. So we are relaxed. We don't care about even if it goes to 50, 60, but then it comes up fast to 120, the baseline what KL was talking about, which is 120, 140 in some kids, even 160. I mean, I need to know the baseline, which is like 140, 160. So even if it goes to 50 and it comes back to 140, we are okay. But because you were saying it was going down and going up, like more than 160, and it was going down. So so the variability also we measure how much down, how much up. And but in this case also it was recovering. So that's a good sign. It's a good sign that it
Yes.
was recovering.
Yeah.
So I would have given more time. It was about time here. But again, whosoever midwife and doctor is there with the baby, and the mother is the one who are taking decisions. But KL, my question is about the episiotomy that long. See, vacuum still is okay. For me, I'm sure
Yeah.
you will have different views. But vacuum is just to comfort the mother. I mean, I am comfortable with a vacuum. I am.
Okay. Okay.
But I know I have to change all that. That's why I'm here. But,
Again, these things are created,
yeah.
the system of vacuum extraction or forceps or even cesareans are created with an effort to address issues and real problems that otherwise were not being able to address. And then once we were able to solve these problems, we thought they were so great, we'll use them with everyone. So again, it's hate the sin, not the sinner. So it's how do we use these procedures? So the question is, yeah, Radhakund.
Pretty is in labor. She
Oh.
just sent her. Her husband just sent a picture of her bloody show, and
Okay.
he showed a mucus discharge from last night. So just now she just has a bloody show.
Yeah, all right. Okay.
Yeah.
No, after I
Just
saw them
wanted to-
yesterday, was that yesterday that I saw them? When I saw them
Yeah.
last night, I felt pretty, she was just talking to them, felt like I was calling the baby. I wanted to shut up.
Oh, yeah.
Okay,
All right,
okay,
we got it.
okay. All right, I'll take care of the equipment. All right, so a couple of things. It's interesting, regardless of the cord and all that, with the vacuum extraction, the baby actually was able to come out. And the words that were used was something about the mother was encouraged or encouraged her along, or it helps redirect sometimes, I feel like we're trying to redirect her pushing, or the uterus's pushing efforts. And I get that. Now, some of the of course, I haven't really, okay. I haven't required a vacuum extraction, meaning it's not something I've needed to call for. One of the mothers that I did transfer and ended up with a vacuum extraction, and they go hand in hand with episiotomies. But regardless, with forceps and vacuum extractions, if you're pulling a baby through the pelvis, that means the baby can negotiate and actually can come out physically through the pelvis. Question is, in this particular case, we are seeing fluctuations in the baby's heart rate. thereby raising the concern of fetal distress. As Riddy says, so, and I was asking, what's the baseline meaning? What I want to know is, what's the baby's heart rate between contractions when there are no contractions? So generally speaking, when a contraction comes, especially when we're dealing with second stage labor, and Radhika, we need to clarify what is second stage labor and one other thing you said. So when we clarify that this is second stage, the mother is pushing, they're under the most pressure that they're going to get is during second stage, crowning, going through the vagina, the head starts to mold even harder and reshape, more pressure. So it's not unusual, and in fact, a healthy sign to see a variable heartbeat. We want to know how, and the sooner closer they are to being born, that heart rate can drop really low, like you were saying, 50. But they should recover, especially once the contraction is over, that baby's heartbeat should recover. And that's pretty much what we're listening for. We want to see how the baby recovers. You indicated that the baby's heart rate was fluctuant the entire time during contractions, in between contractions, at rest, or whether they were at the peak. The heart rate was continually to be all over the place, if I understood you correctly. So if that were the case, I don't know what I would do. I'd be a little worried about that. But before, of course, at home, I can't do anything. I have to transfer. If I can't do anything spectacular at home. I can only encourage the mother to push. I could do an episiotomy if I felt it would help. It doesn't sound the way you described it, that an episiotomy at that point in time would do anything. It sounds to me too that this was a high vacuum extraction. Or, oh, you said 0 station, so yeah, kind of high. If we're at 0 station, that's pretty high for an extraction. And for forceps, I would think. But it's not my field of expertise. But it would definitely, so for me, I'm at home. I don't have these things at my elbow. I'm concerned about a baby. I look to the mother and I tell her, I'm concerned about your baby. There's the reasons why. Things I would do if I couldn't get a steady heartbeat or get this baby to settle down. I'd be checking the mother's blood pressure as well. I'd be checking her uterus and seeing if anything else any other disaster is unfolding itself, such as high blood pressure relating to something else that's delaying this process. Something else I was thinking of, oxygen. You can give the mother oxygen, and as she oxygenates her bloodstream, this oxygenates the baby's bloodstream. I would tell the mother then and there, I need your baby and I need your baby now. You know my speech. I would explain to her why, explain to her what I'm seeing, da-dee-da-dee-da. I make it very clear with her. She's looking at me. I get her to look in my eyes. I'm talking to her. And usually that's enough. And the women just next couple of contractions, there's a baby there. Changing positions. Somebody might have mentioned this. I think you did. So this is something you often do also with fetal heart rates. Try to change position. I'm not so sure about the constant rebozo. It really depends on what is actually holding the baby up. Just wondering. So I wonder if there's a possibility as we're shaking this baby in such a way that, I don't know, just a thought. What else do I think? And if these things didn't work then, and the baby's heart rate is still an issue, I put oxygen, I give oxygen by mouth to the mother, and I would transfer her. If I couldn't get that baby up. or out. If I couldn't get the fetal heart rate up or I couldn't get the baby delivered, I would transfer. But I actually haven't had that kind of issue. Okay. All right. So as you know, I got stuff to do. Yes. The father's messaging me now. I guess I'm getting the same photos. Oh, that was from yesterday, apparently. Okay.
Don't
And
worry,
another
he's sending work today as well.
Yeah.
I was going to send you those photos, but yeah.
And then another one an hour before. Okay. All right. I'll get ready. I'll put the plastic sheet in the thing.
Don't
All
forget
right.
the apron.
Okay. Aprons, plastic sheets, fetal monitor.
Doppler. Mhm.
I'll see where the
BP
bottle is.
monitor.
Okay. All right. Got
Mhm.
stuff to do, people. All right. Thank you so much. It was a lovely class and look forward to the next one. Okay. See you guys. Bye.
Thank
Bye.
you.
Wish us luck.
All the best.
Thank you.